The reality is in the first session, there's a whole host of things we could do with the patient. So it's the ability to prioritize the right stimulus at the right time for the nervous system in order to get on that right road. Okay, now that's the thing I always struggle with in private practice. Hey, welcome to the Go-To Physio Podcast. My name is Dave O'Sullivan, and in this podcast, my aim is to give you 15 years of my experience in professional sport and private practice and share that knowledge so that you can get real world results with your complex patients who have failed traditional approaches. I hope you enjoy the show. This week's episode, I want to talk about how to always give more value than you take in payment with patients. And this is absolutely critical. If you work in private practice, I know I had a big mindset issue about taking money from patients at the end of sessions. And what I want to do with this episode is show you a framework that you can use to always make sure that you give more in value than you take in payment. Now, we've got 4 types of episodes on the show usually. This is a HPP episode, which is a Happy Progressing Patients episode. This is an episode where I'm going to go into a concept that I cover in the book in a lot more detail. So you go from knowing this content to actually genuinely understanding it so that you can apply it in the real world. Getting into it today, the way to always give more value than you take in payment so that you have happy progressing patients is a really useful formula, okay, or framework that I've come across. Now, I want to give absolute full credit to a guy called Alex Hormozi. So he wrote a book, a marketing book, and it's I think it's called $100 million offers or something like that. So again, don't get too worried about the name and let that put you off. But ultimately, he gave a framework, and when I looked at it, I was like, yeah, I've been doing all of this, but what I wasn't doing is I didn't have a simple way to actually audit the different parts and what I was doing well and what I wasn't doing so well. So the framework that I talk about, it's in page 60, 61 of the book, okay? So what we're talking about here is a way where we're able to see how all the pieces fit together in a subjective assessment and always give more in value than you take in payment. So value and his value equation that he came up with that I've kind of adapted to private practice is essentially value equals your patient's dream outcome multiplied by your patient's likelihood of achievement, okay, then divided by the patient's perceived effort and sacrifice multiplied by the time delay that it takes for the patient to actually get the result or the value. So in order to kind of make this feel a little bit more easy to understand, I want to give you a simple analogy here, okay? Now, value is the patient's dream outcome. So let's have a look at a gym membership versus liposuction, okay, for argument's sake. So a person's dream outcome is they want to lose 20 kg or 20 pounds, whatever it is for argument's sake, okay? So the dream outcome by the perceived likelihood of achievement, okay? So I want to lose 20 kg or 20 pounds, whichever we want to say. Let's say 20 pounds, a bit more realistic, okay? The likelihood of achievement, okay, well, I have to go and join a gym. Will I really be able to do the work? Will I be able to stick to the diet? I haven't been able to do it in the past. So for that kind of person, the likelihood of achievement is quite low, okay? Then we look at the other 2 components of it, the effort and sacrifice. Oh, that's a big effort and sacrifice. I have to go to the gym, I have to work out for an hour a day, and then the time delay, you know, it might take me 6 weeks before I start to see, you know, noticeable results that I'm even getting close to that 20 pounds, okay, or whatever it is. Now, we look at that and we go, okay, gym membership, you can get a gym membership for probably 20 quid a month, okay? So the value that we can charge for gym memberships, it could be that, or we can have a little bit of a nice boutique gym. You might get 100 quid a month, whatever it is for argument's sake, okay? Now, we contrast that to liposuction, okay? Where they're charging, you know, 3,000% more than they're charging for gym memberships, okay? They can charge a lot more money because the patient's dream outcome is to lose 20 pounds. The perceived likelihood of achievement, it's very, very high. So the patient's like, well, if I have liposuction, I'm going to lose 20 pounds or whatever it is, okay? The time delay, well, bar the first, you know, few days of being sore and bloated and whatever it is, then I'm going to get that 20 pound loss within a week or whatever it is, okay, after I've kind of got through the surgery. And then the effort and sacrifice, well, bar that bit of pain post-surgery, okay, it's pretty minimal. I lie on a bed, I go to sleep, and stuff gets taken care of, and I wake up, I'm a little bit sore, and then I've lost 20 pounds. Okay, now I know that's a stupid way, to explain it. I'm not condoning liposuction or anything like that over being active and exercising. Okay, but I want you just to understand the difference there in the perceived value for the patient. Okay, now the word perceived, I think, is probably the most important thing of all there. Okay, a lot of people will perceive liposuction to be more valuable and willing to pay, I don't know what it is, £3,000 for argument's sake, okay, versus actually going to the gym. Now, of course, going to the gym, actually exercising, looking after your diet, it's going to give you a whole host of additional benefits, and that is, 9 times out of 10, for most people, it's going to be the better option to do, okay? But human nature and stuff like that, a lot of people will still choose the other way because it's quicker, we get results, okay? And we're willing to pay more money for that, okay? Now, I want to take this weird analogy that I'm using and I want to bring it back into private practice, okay? Now, before I get back into the specifics of private practice, I want you to understand, Hormozi says something really important actually in his book, and he says, the best companies in the world, they focus on decreasing the time delay of the bottom line of the equation. So the bottom line of the equation is the time delay multiplied by the effort and sacrifice, okay? So the best companies in the world focus on decreasing the time delay and the effort and sacrifice. So that's where Amazon, again, is one more analogy for you, is a really good example of that, okay? That's where I'll probably pay a little bit more on Amazon, okay? I can get out my phone right now and I can order something, okay? I can order a copy of Happy Progressing Patients on Amazon very quickly, okay? Now, Amazon price for most stuff, okay, you might pay a little bit more, you might pay a little bit less, whatever it is, okay? But in terms of, let's say for argument's sake, we paid a little bit more on Amazon, okay? I might be willing to pay £1 or £2 more for something on Amazon because I take up my phone, I literally don't even have to log into the app, okay? I click a couple of buttons and I know it's going to be here tomorrow, okay? So the effort and sacrifice to order it was minimal. I didn't have to log in, I didn't have to give my name and address and all of that because my credit card's stored in that or whatever. And I know it's going to be there tomorrow. Next day, shipping, okay, time delay and effort and sacrifice, they're minimal, okay? That's very valuable to somebody, okay? Now you consider somebody else who is going to shop around, okay? I have to go on the internet, I have to shop around, I have to find the best price, okay? Which means there's more effort and sacrifice. And then I have to get my credit card, then I have to register and I have to put my credit card in, more effort and sacrifice. And then it's going to be 3 to 4 days shipping for the item that I've bought. Okay, so the time delay is more. Okay, the effort and sacrifice is more. Okay, that's a lot less valuable to me than actually paying a couple of quid more to save time and get the thing tomorrow. Okay, so the key point here, bringing this back to the world of private practice, is patients value time, obviously, and effort and sacrifice. Okay. We put a big value on those things like liposuction, like the Amazon example there, okay? So if we can decrease the time delay it takes for the patient to get value and also decrease their effort and sacrifice, okay, then they're very valuable things. Then the other side of it, we want to increase their dream outcomes. So we want to solve big, valuable problems for patients to increase the value that we're giving to them, okay? Rather than just thinking about back pain, what's the problem that back pain's causing that patient? And if we can solve those problems and get them to their dream outcome, and ultimately the patients come to you because they have a dream outcome. They want to get back to fishing, golfing, picking their kids up, gardening, whatever it is. That's the dream outcome. I want to be able to do that with thoughtless, fearless movement, okay? Then the likelihood of achievement, okay? If they know that they're going to get to that result, then that's very valuable to patients as well. Now, I want to look at these 4 components with a persistent pain patient, okay? So a persistent pain patient, the value, okay, is the dream outcome for them. They mightn't even want to be pain free. Them, again, if you've been a part of my clinical reason challenge, you see the patient case study I used. That girl, she just wanted to be able to sit at her desk and study and get her pay from a 6 to a 4. That was her dream outcome at the time. Okay. Now, interestingly, the perceived likelihood of achievement for a lot of these persistent pain patients, it's really, really low. Okay. So for that girl, her ability, she'd been to chiropractors, osteos, physios, sports physios, pain management teams in the community, NHS, she'd been to them all, okay? So her perceived likelihood of achievement was rock bottom. She wasn't particularly confident that she was going to get the results, okay? So her dream outcome was quite low level, like she wasn't trying to set the world like she wanted to get her pain from a 6 to a 4. That was her dream, to be able to do that. So her perceived likelihood of achievement, obviously to get back pain free, was rock bottom, okay? Now what you find is as you start to hit the milestones with patients, that perceived likelihood of achievement will start to grow. And you know, there's one classic Google review that we've had for the mentorship, Laura, she works with persistent pain patients all the time. She says in her review, which I thought was really interesting, she says, a lot of, like, the mentorship's great, blah, 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 as you'd expect, okay? Shameless plug there. But then she said, the good thing is that patients will come back time and time again and they'll reset their goals as we start to hit the milestones. So what's happening there is the patients perceive likelihood of achievement. They don't believe that they can do a lot of these things again. But once they start to hit a lot of these things and they do them for the first time again pain-free, their confidence, their self-belief starts to increase, and then the likelihood of achievement of actually living pain-free, or certainly doing things that they thought they couldn't do pain-free, okay, or certainly do, you know, comfortably, starts to rise. So that's where a lot of times we're going to be working on increasing their dream outcome for these persistent pain patients, or any patient, because we want to, if their likelihood of achievement is low, then their dream outcomes are probably going to be low. The more increased perceived likelihood of achievement increases in their belief in that they can actually do these things, then the higher goals and the bigger goals patients will set. So for that girl with the clinical reasoning challenge, she just wanted to sit pain-free from a 6 to a 4. Once we achieved that pretty quickly in the first session or two, then she started to go talk about, she wanted to do swimming, she wanted to do various other things, walking, all of these things pain-free. And after we got into session 4 or 5, then she started to believe that she could do all of these things. Okay, so that's an example there where we want to increase the things on the top of the equation. Now the bottom of the equation, want to decrease the time delay. Okay, now I'll talk about that, and I also want to talk about decreasing the perceived effort and sacrifice. So they're the two components that we ultimately want to reduce. Okay, so I talk a lot with therapists, you know, when we do calls to see if the mentorship's a good fit. I always talk about the importance of starting fast with patients. And what you're doing when you start fast with patients, you get a big emotional win for a patient, is you're decreasing the time delay. Okay, so a lot of patients, they come to you because they want to get that dream outcome. But the thing that makes them stay long enough to get the dream outcome, as I've spoke about in one of the other episodes about answering the 4 pro sport questions, is the importance of these milestones. Okay, so the milestones, and I'll just get that up, so I'll just show you the actual episode. So the episode that I talked about that in is episode 9, season 3, episode 9, or episode 41 of the Go-To Physio Podcast, where I talk about the 4 pro sport questions. And in that episode, I talk a lot about the milestones. Okay, if I want to go from Huddersfield to London, I know I'm going to go Huddersfield, Sheffield, Leicester, Northampton, Luton, and then I'm going to hit London. Now, the big thing here, how we can give patients a lot of value, is that we can decrease the time delay it takes to hit the first big milestone. So patients come to us because they have a problem. Okay, I want to get to London. That's my problem. I'm in Huddersfield, I want to get to London. Now, we want to decrease the time delay it takes to get to Sheffield, because the patient knows, okay, when I get to Sheffield, I'm one step closer to getting to London. So hitting these milestones along the way, that's the thing that's going to make the patient stay long enough. So I know I'm going in the right direction. I know I'm hitting Sheffield. Okay, great. I'm on the right direction. I've hit my first milestone. Next stop is Nottingham or Leicester, wherever it is. Okay, so it's really important that we hit these key milestones. So with that girl, the ability for her, one of her first milestones, to be able to sit with her at her desk and have her pain from a 6 to a 4, is actually be able to sit pain-free for an hour. So one of her first milestones that I did with that girl was help her to relax when she was sat and get her pain levels down, and she was able to sit pain-free for an hour. Okay, so not just from 6 to 4, but actually 0. Okay, so then that was the first milestone. I can actually sit now for an hour. Then the next session, she was up to 6 hours, 4 to 6 hours. Okay, so she could see she's making progress on her goals. And then, as I said, she changed her dream outcome then because her perceived likelihood of achievement increased. So the quicker that we can decrease the time delay to either hitting the first milestone along the way to the dream outcome, so the patient clearly knows they're on the right track, or that we're making progress towards that milestone. That's absolutely critical. Okay, so we have to decrease the time delay. Now, the skills that we need to do that, we need to make sense of the patient's symptoms. We need to understand what's not doing its job. Okay, and then what we need to do or show the nervous system that it's safe to tolerate load, so that the symptoms usually don't have to do too much work. Okay, so that they're going to be some of the key skills: the ability to prescribe the right exercise at the right time, and what to treat first in the first session. Now, the reality is, in the first session, there's a whole host of things we could do with the patient. So it's the ability to prioritize the right stimulus at the right time for the nervous system in order to get on that right road. Okay, now that's the thing I always struggle with in private practice compared to pro sport at the start, is what I've only got a certain amount of time with the patient. I have to prioritize the treatment. And again, I can't treat everything. Okay, I see a lot of people, I talk to a lot of people, oh, I'm a holistic therapist, I treat everything. For knee pain, I'm going to do the suboccipitals, I'm going to do the sole of the foot. I'm like, oh, that's exhausting. It's the ability to prescribe the right exercise, the right time, or the right stimulus with your hands or whatever it is at the right time. That's going to be a key skill there in order to decrease the time delay. Okay, then we get on to the other concept here, which is the perceived effort and sacrifice. So if we want to decrease the perceived effort and sacrifice for the patient that Hormozi talks about in that equation, then we need to think about patient motivation. Okay, so every time that I ask a patient to go lie on their back, use some heavy equipment, or they need loads of equipment and all of this stuff, there's a lot of effort and sacrifice. Said another way, I'm relying on motivation a lot as well. Okay, now again, I'll do a whole episode on Fogg's behavior model, because I teach that in the mentorship. I think it's brilliant. Is behavior is motivation, ability, trigger. Okay, so again, a lot of patients, they'll be highly motivated in the first session, and when we look at the literature, we can see that most patients, they will do their exercises in the first session or two out of loyalty to the therapist. But as time goes by, they're only going to do their exercises that are easy to incorporate in everyday life, and the exercises that give them the most benefit. Okay, so again, here we have to think about what exercises and what treatment plan we're doing to decrease effort and sacrifice. So how do we do that? Well, I've got a concept in happy progressing patients that I talk about, the 6 hours versus 6 reps. What does the patient have to do for 6 hours a day versus 6 reps? So rather than thinking about a rehab exercise that they're going to do 3 sets of 6 reps or 10 reps for, think about what the patient has to do for 6 to 10 hours a day. Okay, so that's where then we can focus on, okay, well, if they're going to be sat for a long time, there's an opportunity to practice here. So where can I get my rehab in to their daily life? And that's where the Fogg's behavior model, the trigger, becomes really important, which, as I said, I'll do a whole different episode on that, because I think it's that important and it's that good. Okay, so the ability to incorporate the exercises into their everyday life, it's non-negotiable in private practice. The one thing that I'm worried about now, and the way our profession is going, is it's the world of Instagram, and to create all of this content is a lot of people are showing a lot of different exercises where we're getting patients to lie on their back on benches and all of this stuff, and it's all like real great stuff, and the content's brilliant, but the practicality of implementing in the real world, I have hesitations. And that's where certainly that we use in the clinic here is do the basics extraordinarily well. Okay, what are the things that the patient's going to do throughout the day, and then how can we incorporate our exercises into that? And if you can think about that, then what happens is the rehab exercise, it solves a problem. And that's very empowering for you as a therapist, as you go, okay, I have a problem with this patient that I have to solve. What exercise or what movement can I use in their everyday life that can solve that problem for the patient? And that question, asking yourself that question, it gives you a lot of focus, gives you a lot of great focus. Okay, so now all of a sudden I'm decreasing the effort and sacrifice the patient has to do in order to get the result. Okay, because as I said, most patients, they'll lie in their back, they'll do all these exercises for you for the first few days, but then motivation and naturally dips. It's human behavior. Okay, so that's the key thing. And then the key step 5 here that I talk about on page 60 in the book is we have to use this information to focus our objective assessment and treatment plan design. So once we understand the dream outcome, once we understand their likelihood of achievement, once we understand their effort and sacrifice, okay, and their time delay, how can we decrease time delay, how can we decrease effort and sacrifice, that's where you can start to assess these things. Okay, so step 1 is we have to understand the patient's dream outcome. Okay, So what is the ultimate result they want? It's important to understand this, as our treatment plan needs to be optimized, always working towards this. What is the patient's definition of success from working with you? Okay, it's another powerful question to ask. Step 2, we need to understand the patient's perceived likelihood of achievement. Okay, so this step allows you to ask questions that give you an insight into their actual likelihood of achieving their dream outcome. For persistent pain patients, they might have a low perceived likelihood of achievement. Okay, whereas a first-time acute back pain patient, they might have high confidence that they're going to get this sorted. Okay, so as I said, it's important that, and that's really important to set realistic expectations and progress also. Step 3, we need to find ways to decrease the time delay. Okay, so as I said, what's there a way that we can show the patient that they're on the right track? So with that girl that wanted to sit from a 6 to a 4 pain level, for me to decrease her time delay, the first session is I went and I actually got her to relax her back when she was sat. Whereas if I'd got her to do loads of glute bridges and all of that stuff, it's questionable whether that would transfer through to sitting pain-free. Okay, so the skill that she needed to sit with her back relaxed was she needed an ability to relax her rib cage, okay, stretch her diaphragm or mobilize her diaphragm, get the rib cage to relax in the press, and then that will relax her iliocostalis. Okay, and then very often that's going to decrease the pain experience. So I had to educate her on that, get her to relax as she sat. That's a way that I can decrease the time delay. If I had gone, okay, she's got weak glutes, she's got a weak core, I'm going to give her some exercises on her back, I'm going to get her to do some bridging and all of this stuff, that's going to increase the time delay essentially to getting her the result that she wanted. Her dream outcome is just to sit with a 6 to a 4 pain levels. Okay. Then also I found ways to decrease the effort and sacrifice. So I don't need her to lie on her back to do glute bridges and core exercises. I can just get her to sit because she's going to be sat anyway. Okay. So that's an example of that. So that's step 4. And then step 5, use this information to focus your objective assessment and treatment plan design. Okay, so as I said, the final thing to note is that people buy the long-term value. Hormozy says this in his booklet as well. Okay, the dream outcome, but the thing that makes them stay long enough to get it is the short-term experience. So that's where decreasing the time delay, decrease effort and sacrifice. So you'll use this information to show them that they're on the right path. Okay, and that's ultimately, we want to give them a big emotional win early. And this gives them big emotional buy-in and momentum to see it through to their ultimate goal. So as I said, persistent pain patients, their ultimate goal, they mightn't actually disclose that to you in the first session. So with that girl, you know, being able to get her pain-free, sat pain-free for an hour, that's a big emotional win. I can actually study for an hour pain-free. And then the next session, she's buzzing. She's like, yes, I'm on the right track here. Actually, do you know what? Maybe I can actually get a bit longer than an hour. Okay, so the work comes before the belief. Okay, so going through this process, we'll focus on the person first and foremost, and more than likely take you down a completely different treatment approach. So rather than just having her on her back doing glute bridges and planks and all of this stuff, I've just got her sat down. Okay, I've got her in a position, and then I go, okay, what's the skills I need in order to achieve this? What's the problem I need to solve? What's not doing its job? That if it was doing its job, this problem would no longer be a problem. All of the past episodes in season 3, I've used all of the content from those episodes with that particular example there. Okay, and then you can use this framework with your tricky cases or your own therapists. Okay, so practical application, I'm on page 64 now. Okay, if you want to instantly increase the value to your patients, focus on these 3 simple steps. Step 1, solve an actual problem worth solving for your patient. Okay, what is the real problem the back pain is causing them? Okay, don't solve a weak glute, solve a way for your patient to pick their grandkids up pain-free without having to think twice, thoughtless, fearless movements. Okay, that is a problem worth solving with your patients, in your patient's eyes. The weak glute is just a little piece of the puzzle. Step 2, deliver results quick, okay, or quicker. Instead of jumping in and treating the first thing you see, step back, come up with a strategy rather than a tactic to get the ultimate result. What is the first milestone that you can hit with your patient so they can feel the difference throughout the day? So that girl, she could feel the difference of sitting pain-free or with reduced pain studying. And then step 3, reduce your patient's effort in the process. So I didn't need her to do loads of glute stuff or core stuff. I just got her to sit in the position she's going to be sat anyway, and I taught her some skills to relax her back. Okay, so at a first glance, you might think I'm talking about doing more hands-on treatment. I am not. What I'm really talking about here is fitting your rehab exercises into your patient's daily life and routine. finding triggers that remind them to do the exercises rather than just relying on motivation alone. And as I said here, we'll cover this more in the treatment plan design framework, and I'll do an episode on Fogg's behavior model as well, because I think it's really important. Okay, so dream outcome, perceived likelihood of achievement, they matter. Okay, we have to understand those in the subjective assessment. Decrease the time delay, you get that information in the subjective, and then the objective tells you what you need to do in order to achieve it. And then effort and sacrifice, that's where your rehab exercise selection has to be helping the patient rather than relying on motivation. You get all that information in the subjective assessment and you assess it in the objective assessment. Okay, very, very powerful stuff. All this is going to do is it's going to help you refocus. And the reality is it's probably not going to change that much. It's just going to change the order that you do things. Okay. Now, the last thing I want to say, and I say this in the mentorship program coaching calls as well, I'm not against you lying on your back doing exercises, by the way. Okay. And there's some exercises in the mentorship that we teach lying on your back. But what I want you to understand is that actually, yeah, if you're going to give exercises lying on the back, then probably give them in the first session when motivation is sky high. But the reality is, as we progress the patient and as motivation naturally dips, that's where they need to be able to incorporate this stuff into daily life. It becomes even more important. Okay, so if you're going to do stuff on your back and needing a lot of motivation, do it in the first session, because that's probably the highest chance of your patient actually doing that stuff. As the literature suggests, then they're only going to do stuff that they either feel a difference or that it's easy to incorporate into their daily life. Okay, that's it for this week. As always, no adverts or anything like that. If you've enjoyed the show, please share it with a colleague. The people that are going to benefit most for this is people who are living in pain who have failed traditional approaches. The more clear, the more confident we are as therapists that can make sense of the symptoms, get buy-in, adherence and retention of patients, keep them progressing all the way to their dream outcomes. The only people that are really going to benefit from this ultimately is patients who are living in pain who have failed traditional approaches. So if you got value, share it. If you've really enjoyed the show, then if you want to do me a favor, go leave a review on iTunes or Spotify or whatever it is. That just helps us get this in front of more therapists who can then ultimately help more people. Okay. As always, if you want your questions answered on the show, head over to go2physio.com/questions. I'll be doing a lot more of those types of Q&As in the podcast episodes in the coming months. If you want to pick up the book, go2physio.com/book. Okay, for our special project for therapists who aren't quite ready for the mentorship, go2physio.com/members. And then if you want the most simple and direct path to have the clarity and confidence to give patients more value than you take in payment, head over to go2physio.com/mentorship. And then I'll show you exactly what the mentorship is. We'll schedule a call, we'll have a chat, either myself or Shane, my head physio, and we'll see if it's a good fit for you. Okay, have a great week, solve big problems for your patients, increase the perceived likelihood of achievement, increase the dream outcome, decrease the time delay, decrease the effort and sacrifice, and you will be giving your patients more value than you take in payment.